Hi, my name's Summer May Finlay. I am a PhD student and this is my PhD blog. So I thought I'd give you an update of where I'm at in my PhD since it's been some time since I've done that. And so just so you remember, my PhD is looking to understand the impact of the National Key Performance Indicators on the Aboriginal Community Controlled Health Services. For those of you that don't know, there's about 150 Aboriginal Community Controlled Health Services around the country. And what they do is supply primary healthcare services to Aboriginal and Torres Strait Islander people. So essentially, they're services run by and for Aboriginal people and Torres Strait Islanders, my apologies. So what are the NKPIs? The National Key Performance Indicators are indicators that were set by the Commonwealth in 2012 and are designed to measure process and outcome, and they're also around chronic disease and child and maternal health. So there's a set of 24 that were implemented over a period of time. So what I really wanted to do was see what has this implementation done for the services and at the service level. So I've got a couple of phases. I'm including document analysis of the NKPI reports. I'm looking at case studies with 5 ACCHOs, looking at that kind of in-depth what's happening on the ground. And soon I'll be doing a survey with all the ACCHOs. So I've done my document analysis, looked at the NKPI reports, and I've written that up, or almost finished it, depending on what my supervisors say. I'm currently writing up my case studies. So I had 5 case studies at 5 different services across different locations in Australia with remoteness and geographics. There are also different sizes as well, so some have a large number of clients, some have small. And the idea is that to get a cross-section to see what might actually be happening really in depth at those services. There's going to be some differences and also some similarities. And so the idea is then that I'll write the survey, which I'm actually in the process of doing, which will then see if those results are generalisable. Because based on 5 case studies, I actually can't see whether or not this is actually stuff that's happening across all the services. And the idea is to really start having that conversation with people on the ground, because a lot of the time it's really challenging for policymakers to be able to do that work. It's time and labour intensive, and so I know that the NKPIs are problematic for the services and have always been problematic. That's not been a secret. So I thought I would actually look at what's actually happening, so take that anecdotal evidence and make it evidence that policymakers and other researchers can trust and rely on. And that's not to say that anecdotal evidence isn't trustworthy, it's just that people don't place as much value on anecdotal evidence as they do research which has been through the peer-reviewed process. So right now I'm literally going through and writing up my first case study, looking at all the data, looking at the results from that case study. And I have to say, this has probably been part of the bit that's been the most challenging, is I have so much data. I did 24 interviews, anywhere between 7 minutes and an hour and a half, and I'd say on average they lasted about 45 minutes. And you can imagine how much richness you get out of a conversation with somebody for 45 minutes. And if you think about a peer-reviewed journal article, which is going to be something like 3,000 to 5,000 words, and I've got 5 case studies, and I have 140 pages of quotes taken under each of the themes. So with my thematic analysis and my coding, what I've actually done is I went through a couple of times and read them over and over and over and over again, to the point where I started to get a really good grasp on what was happening in the dialogue. And so what I then did was do some high-level themes and then do some self-coding underneath that. And that's evolved over time, and even today I started to think about how I might need to recode some of it, because there's a lot of duplication in one of the themes in particular, or 2 of the themes, and I thought maybe it would be better to merge them. So it's an iterative process, it keeps going, and I know I'm going to have to get to a point where I'm going to have to stop doing that, but at the moment I don't think I'm quite there. I am meeting one of my supervisors on the 22nd of January to kind of look at finalising that and to see how I'm going with the writing. So fingers crossed it all goes well. I should have all my analysis done by the end of January, and most of it written up, and my survey should be ready to rock and roll about that time as well. So there's the update. Not sure when I'll give you another one, but stay tuned. Thanks very much.